Well, good morning, Cheryl. It looks like you and I are the only ones on here.
I'll be right back with you, Anita, but good morning.
Good morning to you. Oh, well, there's Jared. Good morning, Jared.
Everybody ready? All right, let's get started. Time being 9:01 a.m. on July 20th, 2022. I'd like to call this meeting to order of Kane County's Public Health Committee. Clerk, please call the roll.
Lewis,
Lewis here.
Shepro, Strathman,
Strathman here.
Pepe,
Pepe here.
Wallace, Silva,
Silva is here.
Sanchez.
Sanchez present.
If quorum.
All right. Can I have unanimous consent? Can someone please ask for unanimous consent to approve the minutes of June 22nd, 2022?
Pepe moves.
Pepe asks
Lewis
unanimous
second.
consent. We don't need a second. No objections. Minutes are approved. Finance and budget. Does anyone have any questions for Cannell on this month's financial reports? Hearing and seeing none, we'll move on to public comments. Is there anyone here who would like to deliver a public comment here or online? None? Okay, we'll move on to animal control.
Good morning, everyone. All reports are on file. I do have two things I just wanted to cover this month. One is coming up October 2nd. King County will be part of the largest dog wedding. Guinness Book of World Records will be present. You can find out the information at largestdogwedding.com. That's largestdogwedding.com. 50% of the proceeds will be going to Canines for Warriors, which is a great organization for canines and animals. It's a partnership for these wonderful people. It's $25 per dog. And if your dog does not have someone to marry, they do doggy speed dating, and all the information can be found on the website. The other thing is that Saturday, August 27th, we'll be back with our last 3 vaccine clinics for August, September, and October, and we're very excited to get ramped up again and going on those.
Okay, I'm sorry, I didn't get the details on this.
The largest dog wedding.
Yeah, where's it at?
It's going to be at the Cougar Stadium, Northwestern Stadium. It'll be before a Cougars game. It was done in DuPage last year. They didn't win. So we're really hoping that Kane County can do it and put us into the Guinness Book of World Records. It should be a fun event. It was a lot of fun last year, and we're excited to be part of it this year.
All right, thank you, Brett. Any questions for animal control this month? All right, we'll move on. Next, we have Health Department section. Yeah. Oh, yeah, sorry. I glazed right over your resolution. I assumed we passed it already. Can I get a motion in a second to approve resolution 22-08? It has a number already. I did not realize that. Employee job description changes.
Shepro moves.
Strathman second.
Upper moves, Strathman seconds. Brett, can you just describe this to us very briefly?
Yes, with the separation from the health department, FOIA responsibilities and financial responsibilities will be moved onto Kane County Animal Control. We discussed adding a personnel to this, but we don't feel it's necessary. Instead, we're going to update job descriptions and compensate, and the compensation will follow those positions that it is added to. Finance did an adjustment yesterday to the appropriation amount, which was a correction from what it originally listed. So I thank them for helping me get that fixed.
Do we need to amend anything because of that?
No, Erica said it's good to go. That's why this was passed out this morning.
Okay, excellent. Mr. Tepe,
Just, I'm sure you're doing it, but I just want to double check. You're doing all of this through HR, right?
Correct. We've met with the state's attorney's office, HR to update we'll send over our new updates. This had to be approved first, and then it's been reviewed by finance.
Figured that went without saying, but I had to ask.
any other questions or comments or concerns? All right, clerk, take roll, please.
Lewis,
Lewis, yes.
Shepro,
Shepro, yes.
Strathman,
Strathman, yes.
Pepe,
Pepe, yes.
Silva,
Silva, yes.
Sanchez.
Sanchez, yes. All right,
Thank you.
thank you, Brett. And thank you for being here in person. But we appreciate you online. So, all right, Health Department section, we have a new executive director, as we all know. This is his first meeting. He might be a little shaky. He's new to this, so a warm welcome to Mr. Michael Isaacson.
Great, thank you very much. And yes, I appreciate if you can be gentle with me today. It's been a real privilege these first 3 weeks in this new role. So I just want to share a little bit about what we've been doing, and then also talk about what my future vision is. I'll be pretty brief today, and then next month we'll be able to dig into some new things that we have going on. So I know we have a presentation coming up. So just a quick organizational update. If you were involved in the hiring process, you've seen this. What I shared is the key points that I felt were critical for us to be successful as a health department. So number one, alignment with the board. So I've been working closely with Chair Sanchez and Chair Pirog, making sure that we're on the same page. I think it's going to be critically important for me in this role to know what expectations are from the board in terms of what we need to focus on and potentially what we need to move away from. Also, I need to make sure that if I'm doing my job well, I'm providing you with the information you need to make good decisions. Second, as we look at community partnerships and see what's happening, we're a small health department, so we're completely dependent on other organizations in the community. So that's something that we're going to put a big focus on, is how do we continue to grow those relationships? We have tremendously strong networks already in place, but there's a lot of opportunity for us to bring in some new creative partnership ideas, to talk about new ways to do some funding. And so I think over the next couple of months, you're going to be able to hear some exciting things there. Number three is our workforce. And I think that's really the strength of the health department. We have a tremendous team of people who work very hard and are very passionate about their jobs. This is where I've spent the most of my time in the first 3 weeks, is really working internally to understand what everybody's doing. They have the expertise and the experience, especially the people on the front line, really have an understanding of where there's opportunities for us to make some changes. And what I'm finding is I think there's going to be a lot of simple things we can fix process-wise that are going to not only help us better serve the community, but also bring better job satisfaction as we remove some of the pain points from processes that have been our own doing. And then number four, over the coming months, really increasing how we're communicating and how we're sharing data and information. So that's something that we're going to be building up to. So the first 30 days, what my primary focus is going to be on is really understanding where we are with the staff. So I have conducted an survey that's been available for all staff to complete, where they're able to highlight things we're doing well that we can build on, and also areas that we have for improvement. Also have been conducting one-on-one input sessions with staff to hear directly from them. I think I want to build that relationship with all of our teams so that they understand that they have a voice in what we're doing. I think employees who know that what they're doing matters, and that their voice and their ideas can be heard, I think that's going to help us to grow much more quickly even. So tomorrow I will finish the last of those scheduled one-on-one input sessions. I've also evaluated the exit interviews for any employees who've left our agency in the past 4 years, as well as the evaluations from all of our staff meetings over the past 4 years. And there's some themes that I'm pulling out that I'll be able to talk about a little bit more next month. I haven't shared all the results of this with staff yet, so respectfully, I'd like to ask that I have that conversation with them before I bring it to a public forum. But again, I think there's some things that are big things that are going to take us a lot of work, but then there's some other things that are a little simpler and easier that maybe there are our own processes that we can more quickly change. So immediate next steps, we're going to be forming some cross-division teams to address some of these things. So just a simple example is, how do we do outreach in the community? How are our different programs engaging with events that are happening out in the community? We have been relatively siloed. It's actually something that I'm talking about with Director Barrett after this for how we're doing National Night Out. But what we're going to do is we're going to pull staff from different divisions and different programs and just talk about what's the best way for the health department to represent all of our programs and all of the things we do, rather than currently what we have is somebody from this program may reserve a table at an event. Somebody from this program may reserve a table at an event, not coordinated. We don't have the educational materials all coordinated across the division. So kind of a multi-benefit process that we'll do here is, one, we'll engage staff. So we'll see, since they're the ones who know the work the best, they'll come up with the plan for how we do this. Two, we're going to actually address areas that are deficits where we have improvement opportunities, and we'll be able to move forward. So that's something that we're going to be doing quickly. Also, as I've mentioned all along, and we've had good luck in the past bringing together opportunities for residents to be engaged. So not just focus groups, but actually creating a forum where on an ongoing basis, residents can have a voice in what it is that the health department's doing. As soon as I finish this internal focus here this week, I'm going to start to look more external and start to engage residents and community partners more in our process and sharing what the vision will be there. But just like we need the voice of the employees helping us with where we want to go, we also need to make sure that residents have a chance to be active participants in this. So then, as I mentioned, we'll be working with businesses and other community partners. I specifically put businesses because this is not only our social service providers, not only our medical providers, but also employers in Kane County. Everybody needs to be engaged in this. Everybody has an important role to play. And then you can see the fourth bullet there is we'll start to launch the new larger behavioral health initiative that I've talked to many of you about. I've been calling it Thrive by 25, just on the back of a napkin. But how do we bring together all of the efforts that we have in our community? We're still seeing too many suicides. We've had a couple of tragic situations here in the past couple of months where we've lost young people in a couple of our communities. We're still seeing too many overdoses. So we have great initiatives going in these different areas. But now, how can we partner with our courts? How can we partner with our schools? How can we bring it all together into one big initiative where people still have autonomy, because we have different programs that are funded by different organizations that are doing great work, but we can pull it all together so we're all moving in the same direction. So just a quick update today, but next month, I think we're going to have a lot that we can dig into in terms of more programmatic things.
Well, it sounds like you've been busy, Mr. Isaacson. Nonetheless, when are you going to start hiring people?
Oh, so we just made our first hire. So that's obviously a big piece. We have several key vacancies that we're looking at. And then I hope we'll get a couple more on board by this time next month. So
Sounds good. Any questions for Executive Director Isaacson? All right, no questions, surprisingly. Mr. Kenyon,
Mr. Sanchez, just a comment?
Mr. Rathman, you'll be next.
You know, with the deaths from fentanyl, I think if you buy that stuff off the market, you run the risk of getting fentanyl in with your marijuana and the risk of death. Am I correct? Don't the illegal people add that to it?
Yeah, I think we are seeing fentanyl in a lot of things. We're certainly seeing it a lot more in cocaine and in pills where people aren't necessarily expecting it. We continue to do research around the marijuana piece because there's different ideas around that. But I think the theme of what you're saying is anytime you're buying drugs, you don't know what's in them. And so there could be something in it that's lethal. I think that's safe for people to hear.
Maybe not all young people, but you have to hit them. Be careful what you buy.
Right. And the average age for people overdosing is in the 40s. So it's not just young people. I mean, this is hitting everybody across our community.
I haven't heard that it's cannabis laced with fentanyl before, so that's new to me.
Yeah, and we're digging into it because there's different ideas about how much it's happening. And sometimes somebody who may be a cannabis user may overdose. Their family may know that they're a cannabis user, but they may also have been using pills or other opioids. So we're not always sure if there was actually fentanyl in the marijuana, but I think they are finding it. Different people also are saying that when it's burning, it may be different. So we just want to be careful with how we get out there. If that ends up not being something that's a huge problem, we don't want to be crying wolf because obviously people are dying from fentanyl overdoses. And so it is a huge problem. Marijuana is not the primary place we're seeing it though, but it is in everything else.
I think Mr. Kenyon's point is go to a dispensary.
Right.
Shepro, comment?
Shepro, you're next.
Oh,
up.
actually,
Mr. Rathman.
yes, Strathman was next.
Yes,
Mr. Rathman, go ahead.
Mr. Chairman, I just wanted to commend Mr. Isaacson off. He sounds like he's off to a great start, and I look forward to his leadership for the Public Health Department.
Thank you.
Mr. Shepro, go ahead.
Yeah, well, I just wanted to add to what Mr. Kenyon said and what you weighed in. A year and a half ago, my cousin's high school age son bought some marijuana from the Friendly Neighborhood Pusher and died later that night from a fentanyl. It was heavily laced with fentanyl. And and there've been intermittent press articles about the increased amount of fentanyl showing up in off-market marijuana sales or maybe black market marijuana sales. So I think it is a problem, but I recall at Judicial Public Safety last week, the coroner commented, as Mr. Isaacson did, that the bulk of opioid deaths now are coming in the 40-ish range, not with young people, which was startling to me. And I don't know if there's anything that identifies why that might be the case.
And I will say, along with our ability as we increase our capacity to share, I don't like to say data because people kind of start to close their eyes when I say that, but information. So we have tremendous information at our fingertips. And so one thing that I'm going to commit to for the health department is we're going to get you all the information about what's happening with overdoses in our community so you can see at a granular level. Where is it taking place? Who's being impacted? What substances are being used so that we don't have to speculate, but that you'll actually have reports at your fingertips where you'll have that information. And overdoses are just one example. We want to carry that on with violence, suicide, other health issues as well.
All right, any other questions or comments?
Mr. Chair,
Mr. Brown.
I'm not on the committee, but I do have a question, and I'm not sure if it's appropriate to bring it up now or maybe during the ARP committee meeting, but what's been appropriated to the health department is $10.8 million for mental health initiatives. And I was going to bring it up at ARP, but since Michael's here, I'll bring it up now. I'm just wondering how that is moving along. Has there been any application yet to the ARP for the consultants to review, and where are we at with that so they can get going?
The state's attorney is reviewing the health department requests right now. One of the last on their list. I don't know that that was intentional. I think it's just how it shook out. So yeah, they're going through that, but bring it up at ARP and we can get into some more
Okay,
detail on
thank
that
you.
whole process.
So we're through Ernst and Young, now it's state's attorney.
Yeah, state's
and then
attorney,
we'll-
then it'll be the whole team reviews everything and then we'll go to the department head and figure out the rest.
Great.
It's quite a process we have to go through, but what we thought originally would be a very simple exercise in determining eligibility categories for the projects the federal requirements make it much more complex. And it's not so clear cut as we had hoped. We're getting there.
Getting
Oh,
progress.
could I expand on that a little bit then? Because Michael's here and he probably won't be at the ARP meeting, but when the money is, when your request is actually approved and processed, are you getting yourself in the position where you can start to work on these?
Yeah, absolutely.
And
And I
that was
think
one of the
this-
first things
that-
we talked about, I
right.
think, is will you be able to manage that, going forward with your new role and all that? So yeah, he's in the process of
Good,
getting set
Because
up.
that's one of the things is that I belong to Rotary and some other organizations. And one of the things I always talk about is what we're trying to do for mental health and the money that's being appropriated towards that. So appreciate the update.
As you've heard me present many times, I think that's our number one health issue that the community is facing right now. So yeah, the timing on this ARP funding is really excellent because we're in a tough situation.
Ms. Lewis, I see you have your hand up.
Yeah, not to get too much in the weeds, but we started with the fentanyl and all that, but where are we at on vaping? Because remember about a year ago, we had a bunch of people come and talking about how horrible vaping was, and then that's kind of gone away.
So we're looking a lot of our school-based programs, just with COVID,
Mhm.
we had interruptions.
Yes.
But there has been some federal action that you may have been seeing specifically with the Juul brand of vapes, where
Okay.
they're being told to take that off market. There's
Yes.
some legal wrangling going on there. But vaping is just a very efficient nicotine delivery system, and not just nicotine, it can be other substances as well.
Mhm.
It's not well regulated in terms of what's in it. And after decades of declining smoking rates, and my first job actually here at the health department over 20 years ago was forming our first tobacco program. After seeing those successes in the community, the onset of vaping started to literally create more people who had an addiction to nicotine. So that is a big problem. Having the availability of drugs in the vaping also makes it something that we need to be able to monitor. So we're watching what's happening with the specific Juul brand, because that could have a big ripple effect with what's available. There's talk of it being something that's effective for helping people quit. And that may be true in some cases, but in most cases, we're seeing way more people start using a nicotine product rather than using it as a quitting aid. So with our tobacco program, it is something that we continue to have a focus on. And hopefully, fingers crossed, knock on wood, if the fall school year is a little more normalized, we'll be able to be working more closely with the schools again, because vaping is quite a problem in schools, in the bathroom and things like that, because it's so easy for people to just take a hit here or there.
Yeah, okay, thank you.
Mr. Tepe and then Madam Chair.
Two things. One, welcome, Michael, and congratulations. Okay. Second is, I got a phone call yesterday from a local blood bank saying they were really in need of blood, and so I went and gave. And I know that there've been multiple donation programs around. I just wanted to make it a point that they appear to be in dire need. I'm not sure why. Because they have to be in really bad need to call me, but
We thought it'd be.
And-
Yeah.
so they even wanted my blood. Just want to point out that the blood banks are in real need, and anything we can do to help them get that supply up, because I didn't see a lot of people in there donating blood yesterday when I was there. So
Right. Excellent. Yeah, we can definitely help with that.
Madam Chair.
Oh,
you had a
thank
question
you.
or comment?
There was a question, well, the county could have a blood drive, and I was saying, we've got the food drive, let's get that organized, and then we can go to the next one. And definitely a blood drive then, one thing at a time, overwhelming our staff upstairs. I'd like to reflect back on the fentanyl and the mental health. And Miss Lewis gave a wonderful seminar that happened several months ago with the sheriff. I was able to present, and partners, health partners, and you were there as well, Michael, talking about the issue of fentanyl here in Kane County. And absolutely correct. It's in people in the mid-40s, but I'd like to be able to drill down a little bit on that. It's men, Caucasian men in their mid-40s who seem to be the consumers of fentanyl, largest consumers. And if we're going to be looking at mental health issues for fentanyl, and these are people at the prime age of earning money, supporting families, they are married, their children are probably maybe teenagers, maybe younger. Families are counting on them. So perhaps we can focus on that to make sure that our men are in good mental health, so that they can be successful in their family lives and in their career pursuits, whatever that may be, with no judgment, obviously, at all. But what is the actually prime cause of that? Because the loss, as many of us know, the loss of a prime bread earner during that period of time when you have children is devastating, not only to the spouses, but also to the children themselves. So that would be, perhaps we could drill down that a little bit more.
Definitely.
Okay, any other questions or comments for Director Isaacson, Executive Director Isaacson? All right, thank you. And we'll move on. We have a wonderful organization here, a couple ladies from Tri-City Health Partnership. We just want to do a little community spotlight. Did you have an intro for them? Sorry, Mike, or no? All right, so.
Well, I will say that Tri-City is a huge asset to our community with the services, as you're going to hear. And we actually just had a conversation with the state. So in terms of partnerships, and I credit Tri-Cities with going out and making this happen, but we're going to actually, Kane County is going to get additional grant funding from the Illinois Department of Public Health so that we can partner with the clinic to help their patients quit smoking. So kudos to them for really driving to make that happen. But I think it's just a great example of new ways that we can bring resources into our community to better serve our residents. So thank you.
Thank you, Michael. I appreciate that. Thank you again for this morning and allowing me the opportunity to come in and speak. Again, my name is Kim Lemansky, and I have the great honor of being the Executive Director at Tri-City Health Partnership. I have with me Natalia Macias. She is our Patient Advocacy Manager. And I want to, again, thank you all for allowing me to come in today. And I want to spend a special thank you to Madam Chair and to Chairman Sanchez for coming to the clinic and spending some time with us, allowing me the opportunity. Actually, when I first started 6 years ago, Michael came and toured the clinic. And so we're excited to have him in this new role and kind of increase the partnership a little bit. I have going to warn all of you that when I talk about the clinic, I could really go on. So you're going to have to throw something or get the hook. Okay. So my goal today is really pretty simple, and it is to, remind the committee and the county as a whole, or perhaps introduce who Tri-City Health Partnership is, because believe it or not, there's probably people that are listening or in the room that have no idea who we are. And we have been here for 20 years providing care to low-income, uninsured residents of Central Kane County. Blair, do you mind? Okay, thank you. We started out, just a quick history lesson, 20 years ago. As I said, Dr. Patrick Gannon was an ER doctor, and he learned very quickly in his career that there was a definite need to fill this gap of those that had no health insurance, had no access to it, or even the ability to pay for any medical care, whether they had insurance or not. And again, while I could vamp for a very long time about who we are and what we do, there is no way that I could do it justice, as well as one of our patients, Jaime. We had this video done for a fundraiser we did, and please indulge me just for, it's a minute long, and pay attention to what Jaime has to say.
Mi nombre es Jaime Granados Durán y pues y mi vida era problemático porque no podía pagar mi enfermedad en otros hospitales, no tenía recursos para pagar. Y una vez pasé por aquí, miré el anuncio y me aceptaron y mayormente de mi diabetes perjudicó mi vista y estuve enfermo y me ayudaron a ir a la óptica Ice Cleaner en Geneva. La verdad, pues yo diría que me cambiaría mucho mi vida porque no sé qué haría. O sea, me quedo impactado porque hay cosas que tomamos que no sé qué hacer, a lo mejor un suicidio, no sé qué, porque es una cosa impactante. ¿Te imaginas no ver? Mi nieto me da mucho gusto verlo jugar con sus carritos. Llega, me agarra, me abraza y me agarra y todo. Es muy bonito verlo. Ya lo he visto ahorita que guapo está mi nieto y me da gusto verlo. Digo, ¿te imaginas que no tuviera yo mi vista? Yo siento en mi persona, en mi corazón que sería horrible, horrible. O sea, no lo soportaría, al menos yo. Ahorita te lo veo así con el corazón en la mano, no lo soportaría. Pero, o sea, gracias a ustedes con la ayuda que me están dando. Y me siento feliz, muy, muy feliz porque me están ayudando. Y muchas gracias, volvemos a lo mismo, muchas gracias.
All right, you can go to the next slide then, Blair. Thank you. You know, I don't speak Spanish. We're blessed to have 4 bilingual staff members, but I can tell you that when we did that, I didn't have to know what he was saying to understand what was happening. And there wasn't a dry eye in the room, to say the least. One of the things that, you know, that we stress the most at Tri-City Health is the fact that, you know, if people need help, we help them. And, you know, there's some misconceptions and maybe a little bit of education I can provide that there are actually 3 different types of nonprofit clinics in the United States. And the first one on the list here you're going to see is the FQHCs, the federally qualified healthcare centers. And these are the VNA, Greater Elgin, Aunt Martha's. And the biggest difference and their biggest claim to fame, I guess, is the fact that they receive federal and state funding. They bill Medicaid, they will bill insurance companies. Patients may have a stipend that they'll pay. So it's really going to be based off of that. And they collect almost half of their revenue for operations through all of the billing and the insurances that they're going to receive. The second one is going to be charitable clinics. It's very similar to a free clinic, except they, again, will have some sort of an expected payment, whether it is a sliding scale, if it's a suggested donation, or even just a $10 payment. And believe it or not, that $10 really truly will be a barrier for care for many of those patients. And then there are the free clinics, and that's what Tri-City Health Partnership is. And you all know, again, of all of the FQHCs in the community, Tri-City Health Partnership is the only free clinic in Kane County. And free is absolutely free. There is no suggested donation. There is no sliding scale. The patients don't pay for their exams. They don't pay for their lab fees. They don't pay for their medication, and they receive everything for free. When you do have a patient who wants to give back, it is humbling, to say the least. And, you know, standing at the counter one day and a gentleman handed me $7 out of his wallet, and I almost broke down because I know that was a lot to him. So providing the free things that they need really truly does offer them an opportunity to have a higher quality of care in their life. You know, when we talk about some of the different services, everything from the labs, the exams, dental care, medical care, one of the things to recognize is that in the state of Illinois, there are about 52 free and charitable clinics in the state. Of those, only 9, which Tri-Cities is one, have both medical and dental as one clinic. In the United States, there's about 1,400 free and charitable, and of those, about 22% have medical and dental. So this really does give us a unique opportunity to treat these patients and offer such a wider range of complete total care. And by offering now a new kind of an arm, that what we're doing is a lot more on the social service side, it truly is taking care of that whole individual. And when you talk about having a medical and dental team that work together in one building for the outcomes of these patients, the overall care from your oral care to your overall health, by combining those and working stronger together, we have actually had patients who have come off of their diabetic medication because of their outcomes working together and increasing that. So factor that in with the social services that we're really ramping up. Patients are having not only a better health outcome, but better family outcomes. You know, working with the Northern Illinois Food Pantry, and I know the food sustainability question is a huge one for our patients. You know, we are working very diligently right now. I've got to laugh because the stuff that was brought up during Michael's is on here as well. And so working again with not only the food pantries, but we are also working with now the jail. When someone is released from Kane County Jail, they are released with 3 days of medication. And if that is their insulin, if there's inhaler, if it's their antidepressants, they are let out and then they're on their own. So they're going to be coming to the clinic and at least getting 30 days of medication. If they are on Medicaid, right, then we will get them their medication so they have a chance to go find a doctor and get settled. But we want to be able to make sure that these people, when they're released, right, they aren't dropped off of their antidepressants and then go home and start that cycle all over again. And so by operating all of this at no charge is something that we are all very, very honored to be able to do. And having a strong board, as you all know, is a big difference too. Working with, you know, Delnor, Northwestern has been such a huge proponent and supporter of the clinic. So we're able to provide these services because we have a staff of 9, where the VNA has 360. They have 16 locations. They have a $35 million budget. We have a $600,000 budget. And since 2016, we have seen a 50% increase since 2016 in the services and the patients that we see. So working with Delnor has been great because if a patient does need to go and have a colonoscopy or a mammogram, you know, they may get a bill, but then they work diligently with Natalia and the financial aid office so that then we provide that service to help those that maybe can't read. How are you going to fill out a form to not have to pay for your medical care if you can't read? So the bills pile up, the stress gets worse. They don't take care of themselves. That circle is so tragic for so many. So opening this up is really making a big difference, and having people from the board of directors on our board from Delnor makes a big difference, right? We have, I'm sorry, please, Blair, go to the next one. I get going and then I got to remember you're up there. I wanted to show this real quickly. And again, that's the average household. I'm not going to read this to you, but I want you to pay attention to the average household income of our patients. And the fact that right now the average for a Kane County resident is $83,000 for a household income. So if you make $17,000 a year, the federal poverty level right now is $14,000. We ramp that up to 250%. So that same person could make up to $30,000 and still qualify for care. And what that does then, it really speaks to the niche of who we are. Right? We take care of those that have no other options. They make too much money, which is laughable, right, to get Medicaid, but definitely not enough to live on. So that's our niche. And that's what we've been doing now for 20 years. You'll see there that I can tell you real quickly, we had 3,500 visits in 2021. And we're expected to be at just over 5 this year. And we're going to probably go higher than that next year. And that is done again with a staff of 9 and about 150 volunteers. Okay. So if you go to any doctors or dentists in town, if they volunteer for us, thank them, because there is absolutely no way we could do what we do. A little side note there, I don't know if you guys can see that, the little square box, you know, we track where our patients work. And while most of our patients work in the food industry, we actually have a patient who works for the Kane County Health Department. And so I say that just to remind everybody that it truly is your neighbors that we are helping. We have clergy, we have ministers that are patients of ours. Everybody needs help now and again. So we want to make sure that we remove the stigma of going to a free clinic. I think that is very important. When we talk a little bit briefly, I'm trying, about the services, we do offer a new smoking cessation program that we're working with not only the health department, but with Quitline. I talked about the jail. And I wanted to point out something else that I don't know if the county is aware of, but I visited the juvenile detention center as well yesterday. and got to talking to them. And while the Kane County Jail has a dentist and a medical director, the Juvenile Detention Center has a dentist that comes in to treat once a year. I'm gonna let that hang there for a second. Once a year, these kids are treated for dental. And so if they have an abscess, if they have any other issues, they need to be, a court order has to be created. They need to be handcuffed, shackled, and bussed to the county they are from to see a dentist where they live. Right now, I mean, that's insane. I can't even imagine the money. So once a year, kids come to them with 18 cavities. Okay. So I just want to point that out as when y'all are talking about the county as a whole, the detention center and the jail itself might be something just to throw in there. Additionally, we work very closely with Lighthouse Recovery, the addiction side of things. And you had mentioned earlier about the fentanyl. And I don't know if anyone here is familiar with Dr. Steve Holdsford. He has been on our board for 20 years. He was an ER doc at Del Nor. He is now the executive director at Recovery Centers of America. He's also one of the founding board members for Lighthouse Recovery. He's done many, many speeches and presentations on the fentanyl crisis. He's written numerous white papers, as well as he works with the jail. He goes into the jail weekly to work with their award-winning program that they're doing to try to, reduce some of that. We have such a wonderful base that, again, without people like him, you ever want him to come out and talk to you, all you got to do is ask. Michael, if you want to get a hold of him, he would come out and talk to all of you about the addiction that is happening in the country. Could you please go one more, Blair? Thank you. I just want to throw this up a little bit. Like I said, our budget is about 600,000. And while about almost half is done through grants, one of the things that we're discovering is becoming a little bit more difficult is finding grants that are not restricted. And while they definitely have a place and a need, and I understand why funders would want to be able to say, I donated that x-ray machine, or I donated that exam table, finding revenue to pay for the bills and to employ the compassionate, professional staff that we have is becoming challenging. And so finding new opportunities is vital to continue our mission. We're very good stewards with our funding. You can see that with our programmatic expenses are, 86% of what we do. So finding those new ways to not only raise revenue, but cut costs are huge. Just to put things in perspective, while our patients receive all of their medication for free from us, we don't necessarily get it for free. So we have to purchase it. And for a one diabetic patient that needs insulin for 3 months, just a one patient supply for 3 months, our hard cost is $1,200. And when you have a $600,000 budget, you can see how quickly that's going to add up. So as a side note, we take donations of medication. So if you have something that's unused and unopened and unexpired, you can bring it in and we can use those at the clinic. So keep that in mind. So I always joke that, we can't raise our rates. So finding new ways to increase revenue and decrease expenses is truly, that's itself is a full-time job. If you would go one more, please, Blair. I know I'm way over and I will not have the next video play just to, kind of give you a better time range. I'll just tell you quickly that Trish was a substitute teacher and she had to leave her job to go take care of her ailing mother. And then she found herself without health care and she quickly plummeted. And so we were able to be there for her when she needed it. So again, these are your neighbors. We've been serving Kane County now for 21 years and there is no end in sight. I wish I could tell you that no one needed free care, but that is not the case. So I want to thank you all again for today and giving me this opportunity. I'm hoping to come back maybe in the fall and talk a little bit about those ARPA funds. But in the short term, I wanted to thank you all again for just giving me the opportunity to share a little bit about who we are.
Thank you, Ms. Lemansky, for being here. We can take a couple quick questions, but we do have more stuff to get onto the agenda. So please keep that in mind. We have to go into closed session for review of minutes as well. So
Quickly, Ken Shepro.
Mr. Tepe, and then Mr. Shepro.
Thank you.
Ignoring your comment. Okay, I have a problem understanding the difference between you and a greater family organization.
Okay.
Obviously, they're much larger and, have been around.
Right.
Why would someone not be able to go to someone like a greater family as opposed to you
Correct.
which is a free clinic.
Mhm.
Because I know that if somebody can't pay, my understanding is they don't charge them.
That's not true.
That's not true?
That's not true.
Okay.
No, they will really work hard to get them on Medicaid if they can. There's an issue sometimes with whether they are documented or not as to who can be seen. And since even if they only request that $10, a lot of times the wait just to get into to see the VNA could be 6 months. And that's not an exaggeration. I had a woman come to the clinic just a couple of months ago. And I say routinely that people shouldn't have to choose between food and medication. But I'd never seen it firsthand. And this woman came in and she had Medicaid. And she had been diagnosed 6 months before with colitis and Crohn's. And she was at our office and in tears, sobbing, because she'd already been 6 months diagnosed, had not got in, tried to get into her Medicaid provider, tried to get into VNA at the time.
So
And-
part of it is the availability of getting service.
Access to care
Okay,
is a
And then
huge
part of it is that you are totally free, whereas for some people, a $10, $20, $30 charge would be extremely challenging for them.
Absolutely. Absolutely. Yeah, it is a true barrier to care. If you've got to worry about where you're sleeping tonight, even paying that $10 copay or getting to the VNA is an issue. We even offer a rideshare program. We pay about $7,000 a year in Uber so that our patients can get to and from the clinic because we don't want them to miss their appointments.
Okay, thank you.
Mr. Shepro, quickly.
Yeah, just, I did not know that there was anything you could do with unused insulin pens. And my doctor took me off it a while ago, and I have a small supply that I would love to find out how to get it to you. So if you could maybe contact me offline or something and let me know. They've been faithfully stored in refrigerators, so they're
Yeah.
in good shape.
It's truly appreciated, sir. And, you know, I can tell you that it is almost like a party when people bring insulin in because it's so expensive and because it's so needed. It is truly liquid gold that comes in the building. So thank you for that. We will definitely reach out.
Thank you.
Thank you, Mr. Shepro. All right, Ms. Lemansky, thank you for presenting to us today. Your organization is doing
Thank you all.
wonderful work and covering needs of people that just kind of get left to the side. You know, they
Yep.
fall through the cracks.
Right.
Like you said,
Yep.
they don't make enough to take care of their health care, but they
Right.
make too much to allow social safety nets to help. So
Exactly what it is. So thank you for
doing
that.
You and Natalia and the work. And thank you for the tour and everything. So it's very good.
Yep. Thank
Hope
you
to
all.
See you again soon.
Yep. I appreciate your time. Thank you.
Oh, if you could just approach the mic real quick. Otherwise, no one will hear you. And just say your name.
Natalia. I did just want to mention that we are aware of the blood bank's need right now. And so we will be hosting a blood drive August 11 through City, the nonprofit blood bank here in town. I think Kim can maybe get the information out to you and we can maybe
Sure.
distribute that way.
Absolutely.
Thank you.
Thank you.
Can't be there, already gave.
Well, I thought they didn't want your blood, Teppy. All right, we got the COVID update, Mr. Isaacson.
Right, so as the slides are coming up, there's a couple things I just want to bring your attention to. Number one, we still do have monkeypox, which is something that we're addressing here in the community. So just want to make you aware of that. We do have 2 confirmed cases here in Kane County. As of yesterday, the CDC was reporting about 200 in Illinois. So we are working with our medical providers to get vaccine out to them, as well as making sure we're getting education out to people. Also want to just mention, and we'll share more information about this at future meetings, but specifically around gun violence, there's something called the Reimagine Public Safety Act that has identified communities around Illinois that are going to be available, that are going to have funding available to them. So thank you to Chairman Pirog's leadership on this. We've been working very closely and leading a group in Aurora. And I'm hoping, as of yesterday, I hadn't seen the announcement yet, but there's $250 million that's going to come available statewide. And it's supposed to be announced this week. So we will have more information, but we've been working with community organizations, specifically in Aurora, that was identified by the state, so that we're going to have a lot of youth development and victim services and things like that we're going to be able to do, which is going to nest in very nicely with our behavioral health issues. So for COVID, and I'll be very quick with this. This is looking at the community level. So again, community level is looking at not only your case rate, but also looking at hospitalizations. You can see the map. Green is low, yellow is medium, and the darker orange is high. Kane County is currently at medium. We were at low for a while, even though the rest of the Chicagoland area was at high. The things that determine which level you're at are over on the left-hand column there, the number of new cases. So if you are over 200 cases per 100,000 people over a 7-day period, then that bumps you up at least to medium. So you can see currently over a week, we're at 237 cases per 100,000 people. So just barely over that. So we are still seeing some spread. And as we've talked about with home test kits, there's still a lot of cases that we're not identifying. But as I look at the hospitalization data there, you can see we're in medium because of the case rate. But as you look at the other two indicators, the COVID admissions per 100,000 people, low is anything under 10. We're currently at 6.4. And the percent of staffed inpatient beds in use by COVID-19 patients, anything under 10 is considered low, and we're at 3.7. So there's still a lot of COVID going around in the community. But fortunately, right now, we here in Kane County haven't seen the tremendous increase in hospitalizations. So looking at the variance, and I'll just point at the far right column, which is for this most current week, and they use something called Nowcast to project what we have. This BA4 and BA5 are over 90% of the cases. BA5 is causing a lot more reinfection in people, including people who've already had a different illness with the Omicron variant. And it's infecting more people who are fully vaccinated. So we're in another one of those periods where you may have plenty of friends and family who you're finding out are being sick. I know we have a congressman who's currently positive. We have a governor who's currently positive. So there's a lot of this going around. As of right now, these variants don't appear to cause more severe, that should be severe illness, but we are keeping an eye on that.
Excuse me.
Yes.
Ms. Bates, hold on, if you can finish the presentation, please.
So looking at weekly deaths, we're still averaging about 2 deaths per week, but you can see over the course of the entire pandemic, we're still at a low period, which is good news. So, you know, every life is important, but we haven't seen a tremendous uptick. And then in admissions, we're seeing a slight increase over the past few months, but it's still staying relatively low. So as we move into the fall, especially, we really want to encourage people to get vaccinated. We want people to get boosted. We've been working to get the vaccine to those little ones. Now that that's available, we are working to keep the Vax Hub open into the fall so that we have that availability for people. So there's a lot going on. And just my takeaways: get vaccinated and boosted, use caution and get tested after you're exposed. And now we're entering that period. Please, when you're sick, stay home. I know everybody's tired of COVID, but if you have symptoms, please don't go to work, don't go to the party, stay home, and just, whether it's the flu or COVID or whatever, don't share it with other people. Thank you.
You have a 5-second answer question.
Yes. Is there an immunity after you've had COVID?
With these new variants, I mean, typically we see immunity, but with these variants changing, we are seeing more people get multiple cases of COVID.
Okay.
All right, if there's any other questions about the COVID report, if we have time at the end, we do have a couple other things to get through. So thank you, Mr. Isaacson, for presenting that to us this month. I know Ms. Onwuta is out of country, actually.
Right.
So we have a resolution authorizing personnel hiring early childhood program supervisor. If I can get a motion in a second to discuss and approve. Anybody want to make a motion in a second on this resolution? That's on.
So move Strathman.
Lewis will second.
Lewis seconds. Mr. Isaacson, can you describe this very briefly?
Absolutely. This is 100% grant funded. This is an increase in funding from the Illinois Department of Human Services, which is going to increase our capacity to serve the early childhood community. And just to remind people, this all fits together. Social determinants of health and early childhood trauma are a key focus for our early childhood initiatives. So this position is actually going to help with all of our mental health and subsequent substance use conversations as well.
Any questions? Mr. Tepe?
One of the things that concerns me with hiring, whether it's funded by grant or not, okay? Particularly the health department, is that I know you have a large number of open slots to be filled.
Mhm.
And I won't say it bothers me, but I just have to ask the question associated with, we're authorizing new slots, and we've got all of these other slots that haven't been filled. I'm just concerned about the ongoing continuing cost associated with things. So this is not the time to address it, but I'd like for you to address that in the future, if you would, please.
Very good.
Madam Chair.
I would just like to comment and support early childhood education initiatives. As a former educator, school board member, I've learned very deeply how important early childhood education is in the development of our youth and as adults. The capacity for changing a child's trajectory, accomplishments in school, and going on to career starts when they're at the age, well, I'm going to say birth to 2, but when you get them between the 2 and 5-year-old age, and you give them good constitutional planning, should I say, if that's an appropriate word, and a love for learning and a love for success, they succeed greatly. And all the data that has been proven about early childhood intervention documents this consistently, no matter what income level you are in. So I applaud this.
All right, excellent. Clerk, please call the roll.
Lewis,
Lewis, yes.
Shepro,
Shepro, yes.
Strathman,
Strathman, yes.
Pepe,
Seppi, yes.
Silva,
Silva, yes.
Sanchez.
Sanchez, yes. If I could get a motion in a second to discuss and approve a resolution authorizing an emergency purchase affidavit for professional medical consultation services.
Lewis, move.
Strathman will second.
Thank you, Ms. Strathman. Mr. Isaacson, it's pretty simple. If you
Yeah,
wanna just
so
describe.
we have a longstanding relationship with Dryer Medical Clinic where they provide a physician who serves as our medical director. With the expansion with merging with Advocate Aurora, the contracting process has been expanded a bit. So even though we've been working on renewing our contract since about March, it's not going to be completed. We don't anticipate for a couple of more weeks. They do have the intent to continue providing this service. It's essential for us during COVID and with monkeypox that we have these services. So in consultation with the state's attorney's office, they suggested that we do an emergency purchase affidavit so that we could continue these services and then bring that to the board for just for your final authorization after doing that. So
Mr. Cheppy?
Just so I understand, you're saying that this would be paid for by an outside organization if you're,
we're paying, this is always in the health department's budget. We're required to have a medical director who signs all of our standing orders. So this is something we always do. We just have a gap in our contract. So this is going to just allow us to fill that gap where we can continue the services until the contract is finalized.
got it, thank you.
All right, clerk, please call the roll.
Lewis,
Lewis, yes.
Shepro,
Shepro, yes.
Strathman,
Strathman, yes.
Pepe,
Seppi, yes.
Silva,
Silva, yes.
Sanchez.
Sanchez, yes. We have nothing for old business. Can someone please ask for unanimous consent to place the reports on file?
make
I
a
so
unanimous-
request.
Tepe got to you first. Sorry,
Yep.
Shepro. No
It just moves he
objections.
learns.
The reports are placed on file. We need a motion to go into executive session to review closed session minutes.
I so move, Shepro.
Shepro moves.
Seppi, second.
Strathman,
Tepe
second.
seconds. Clerk, please call the roll.
Lewis,
Lewis, yes.
Shepro,
Shepro, yes.
Strathman,
Strathman, yes.
Pepe,
Seppi, yes.
Silva,
Silva, yes.
Sanchez.
Sanchez, yes.
Okay, everybody online, please accept your invite to go into the closed session. Be aware we are live streaming, so anything you say until I give you the word will be still going out live to the public. We'll get started here shortly.
I'm not on.
No, I pull it off your website. I am. Oh, got one, right?
We're here? Right. Oh. Most of them are online.
We're still waiting for some to join the closed session.
Oh, yes, okay.
Hit the button.
Too quick to complain.
Well,
Okay, you are in open session.
All right. Clerk, once you are ready, call roll for attendance, please.
Lewis,
Lewis here.
Shepro,
Shepro present.
Strathman,
Strathman present.
Pepe,
Steppy here.
Silva,
Silva is here.
Sanchez.
Sanchez present.
Corn.
I need a, well,
Steppy moves to adopt the
yes.
amendment suggested by the state's attorney.
Strathman seconds.
Clerk, please call the roll.
Lewis,
Lewis, yes.
Shepro,
Yes.
Strathman,
Yes.
Pepe,
Yes.
Silva, yes.
Sanchez.
Sanchez, yes. All right, nothing for new business. I need a Mike Kenyon motion to adjourn.
In honor of Mr. Kenyon, I move to adjourn.
Second, Shepro.
Jeffro seconds. All those in favor say